All right, so we'll go ahead and get started. Um, Today we're gonna keep talking about bariatric surgery, and then we'll get a little more into what your book talks about, in terms of sort of mind-body connection, your health, that type of thing. And then probably Friday, we'll get to our stuff about COVID-19. Okay. So bariatric surgery is extreme. You are literally adjusting, changing, sometimes removing parts of organs in your digestive tract in order to try to have drastic weight loss. So typically we're looking at, again, BMI itself is very problematic, fully acknowledging that, but typically we're looking at BMIs greater than 40 or a BMI greater than 35 with medical complications. There are two main types. There's also one now called gastric sleeve, but it's sort of just a version of gastric bypass. But there's Roux-en-Y gastric bypass, and then there's gastric banding. Lap-Band is a brand name. There are other types of gastric banding, but I think it's still the most popular. And so with Roux-en-Y, you can lose up to 75% of your excess body weight. So not of your body weight itself, but of the body weight above where the doctors think your weight should be. And with Lap-Band, it's 50% of that. So what do these surgeries actually do to your digestive tract? Well, with Roux-en-Y, what they're doing is they're creating a smaller stomach pouch. And then they remove a portion of your small intestine. And the idea here is not only will you feel fuller faster if you just make a little pouch, the rest of the stomach does stay intact. But by removing part of the intestine, you are actually purposely creating malnutrition or malabsorption. So you're purposely making it so you won't absorb food as efficiently as you typically would. It's called a gastric bypass because the stomach, as I mentioned, stays intact, but you're going past it. You do connect over here so that you get all the stomach acid you need to digest food properly. And this, so essentially, this would have connected to another piece of small intestine, and then you have connected the small intestine after that to your new little stomach pouch. The stomach pouch is now about the size of your fist. This is done laparoscopically, which means rather than cutting you all the way open, they do like 6 holes, put in tools, and one of them is a camera so that the folks can see what they're doing. Lap-Band gastric banding, or again, Lap-Band's a brand name. It's kind of like saying Band-Aid for any bandage, right? But there is a literal band placed around the top of the stomach to make it like gastric bypass without being so invasive. So you're still making a smaller stomach, but it can be tightened or loosened. So this cord you see there goes to a port under your skin, and the doctor can, I think it's just like a saline solution, they can inject more or take more out to tighten or loosen it as you need. It's less invasive. Your diet is less restricted than after gastric bypass. But because it's not doing that malabsorption part of it, you do have to do more exercise. The other advantage to Lap-Band is it's reversible, whereas gastric bypass is not. So let's say you're a woman and you get this done in your early 30s, and then you decide, oh, I actually want to have kids. It's not safe to be pregnant with this in, but they can go in and take it out, and then you can get pregnant. So why on earth was I involved in this? What does psychology have to do with the surgery? Well, anytime you have a significant surgery, it can be really difficult to adjust to it. And the other thing with this surgery in particular is you have to make a lot of lifestyle changes. You have to totally change the way you eat. Because your stomach's so small, you can only eat a little bit at a time. So you need to eat like 6 times a day. There's also a lot of restrictions, as I just mentioned, for the gastric bypass in particular, with what you can and can't eat. And then you need to make sure you have the resources to succeed after surgery, right? So maybe you need to work on like social support within your family or things along those lines. We had a support group, well, it was actually like a behavioral group, but we would have folks go into. We also know, and we've known this in this class since the beginning of the semester when we talked about motivation, that eating and emotions are very linked, right? And those can be difficult to separate even post-surgery. So some people will be like, oh, it's fine. I won't eat when I'm upset after surgery. And it's like, that's not how it works, right? You're still gonna feel emotions and want to eat. And so we work a lot on like coping mechanisms that they can do instead of eating. So a lot of positive things from the research. We see improved mood and self-esteem and improved motivation to maintain those behavioral changes after surgery. But there are a lot of reasons why they might need the support of a psychologist. So that having to only eat small amounts at a time, they can feel really deprived, right? Let's say it's Thanksgiving, like we just had, and you can't eat everything from the big feast. Everyone else around you is enjoying it. That might be kind of the sense of, detachment, deprivation. I just mentioned needing some alternative coping skills. Some folks will face body image issues. So often, especially with the Roux-en-Y, people lose weight so fast that their skin can't keep up. And so they'll end up with like rolls of skin, extra rolls of skin. It kind of looks like the Michelin Tire Man, if you remember that guy. And so some people will have a real issue with that. And although bariatric surgery is typically covered by insurance because it's considered related to health, if you want to get that excess skin removed, that's considered a cosmetic procedure and the money would have to come out of pocket. They often fear weight regain, and that can happen. A lot of research actually suggests that 6 to 10 years out, many people regain the weight because your stomach is elastic. So even though you made it this small, it can stretch back out. And maybe they're not losing weight as quickly as they want to, even after the surgery. So people who have the best outcomes after surgery, they are not grazers. So what's a grazer? What's grazing behavior? It's where you might just eat little bits almost continuously throughout the day. So some people, they're just gonna always doing a little snack, a little snack, a little snack. And that's fine for some people and their metabolism, but if you've had this surgery, you're still gonna be able to do that and it might interfere, again, with your weight loss goals. If you have a strong social network, friends, family, who are going to understand your change and be able to support you in it, you're going to do much better. And then folks who are just highly self-motivated and believe they can do it. That's what self-efficacy means. You believe you can do this. They are much more likely to succeed. One of the really sad things that sometimes happens after this, when I look at strong social network, is let's say both spouses are largely overweight. One spouse gets this surgery. The other spouse sometimes becomes jealous, and that can lead to discord, and sometimes you'll see divorces. The other thing I saw a lot of is you would see someone's spouse come in after they've had the surgery and get set up to do it. And sometimes that worked really well for folks. We would also have, like, I remember one time, my friend and I were both in the same office. We had 2 sisters and we did both their evals at the same time. So sometimes you have people going through it together. People who engage in disordered eating before surgery. So people who might binge eat, or people who just don't have consistent healthy patterns, they do worse after surgery. So short term, they might be fine, like directly after the surgery, but then they revert to their habits, maybe 2 years or so afterwards, and they tend to regain the weight much more likely. And in particular, if they're binge eating pre-surgery, eating that large amount of food in the short amount of time with the sense of loss of control, this is associated with vomiting post-surgery because they have failed attempts to binge eat. So if when we did our psychological assessments, detected any of that, we detected that a person might be a binge eater or engage in other problematic eating behaviors, we would require that they undergo at least a couple sessions of therapy to address that prior to surgery, so that they would hopefully be more successful. So when we did these evaluations, and I did a lot of these, this was essentially my job for a year of grad school. I did 141 of these over the course of a year. We would ask really important things like, why is the patient interested in getting the surgery? One thing that struck me as someone who researches body image is that the vast majority of these folks never mentioned wanting to look better. They mentioned things like wanting to be around to see their kids graduate from high school or being able to play with their grandkids. It was like very pure motivations. We would also quiz them on what they understood about the surgery, about the potential risks of surgery, and what they would have to do after the surgery to succeed. We would talk about their history in terms of weight loss and gain, as well as their diet history. The vast majority of people I did these assessments on, these evaluations on, had probably tried 20 diets in their life. They're like, oh yeah, Weight Watchers 3 times, and the grapefruit diet, and this diet, and that diet. And so you saw a lot of that. Substance use history. One of the things that can happen post-surgery is that, let's say you used to emotionally eat, now you can't do that. Some people do what they call addiction switching and start to use alcohol or other drugs to cope instead. And so if they've had any history of that, we want to know that going in. Medical and surgical history. So if they know things like they have a reaction to anesthesia, those are just good things to like mentally prepare themselves for. Every time I have anesthesia, I get ill, like I vomit. Like while I was having my C-section, I think I vomited 3 times. Right, and so like those things are good to know when they are going into the surgery and like mentally preparing themselves for it. Their psychiatric history, have they been in therapy before? Are they on meds? Right, so if you're on like an antidepressant, you need to work with your psychiatrist as well as your surgeon to make sure you adjust the dose so that it'll work the same after surgery, especially if you get the Roux-en-Y and part of your intestine is gone. One of my friends had somebody who didn't do this, did not work with her psychiatrist, and after the surgery, her medication was off and she became manic. They had to inpatient hospitalize her, and she was walking around the inpatient ward naked, like 2 days after her surgery, like, look at my new body. And so that can happen to the folks as well. And then social history. What is the social support like in their life? Are other people going to support them? Or are they going to try to sabotage them? Who can drive them to the surgery and pick them up? Right? Things along those lines. Things that seem really simple, but that unfortunately, a lot of folks just don't take the time to think about or figure out. And that can, as you can imagine, become problematic down the road because you need that support. You need people in your life who are going to help you. And that goes into their current living and support system as well. So these were the 3 potential results of that evaluation. The vast majority of folks were no contraindications. The patient seemed psychologically ready to make everything they need to make all those changes for the surgery. They're good to go. Sometimes we would recommend therapy, but not require it. We'd say this person would probably benefit, but they're also probably going to do well with the surgery, even if they don't go through therapy. And then sometimes we would have to require it. Like the most common one is, let's say they were emotionally eating, they use food to cope. And one of the questions we asked on our evaluation is, what would you do if you couldn't use food to cope? And some people would just look at you like wide-eyed and say, I don't know. Right? And folks like that are folks who are emotionally eating or binge eating, we would bring in before surgery. And then after they'd been through therapy and we felt like they were ready, we'd send another report over to the surgeon and say, this person is now good to go. So some of the disordered eating habits we'd see is that binge eating, that purging, vomiting in particular, eating in responses to emotions, sadness, nervousness, anger, fear, boredom, and then eating in response to stress. And there's that exact question that I just said. As I mentioned, previous drug or alcohol abuse can be problematic, but also switching can be problematic. So if you are abusing alcohol and often under the influence, that's going to interfere with your ability to follow medical orders, right? You're not going to be able to follow your diet and your exercise and everything else. Alcohol can also be empty calories, which could interfere if you're trying to lose weight. It also absorbs quicker post-surgery, which means you get drunker faster, right? And if you haven't adjusted your drinking habits, as you could imagine, that could be really problematic. In research, people who are abusing alcohol also often are having disordered eating, not only in this context, but in other contexts as well. And that switching or transferring addiction that I talked about. And again, similar with drug abuse can interfere with your ability to follow medical orders. And then the physical side effects can interfere with surgery as well. For example, let's say your drug of choice you switch to is pot. That gives you the munchies, right? So you might be eating more than you're supposed to or more often. We also just check other psychological disorders. So if you're depressed, as we've talked about in our disorders chapter, that's going to be a lack of motivation, a lack of energy, either a loss of appetite or a stronger appetite, which can interfere with your progress. Bipolar, you need that mood stabilized. You need to work with your surgeon and your psychiatrist about medication absorption post-surgery. People who are overly anxious, it can interfere with compliance because maybe you get so anxious you don't want to go to the doctor, right? Or you like get overly anxious and you're like doing things too perfectly and you're just not eating enough. Anyone who is, I mean, just in general, obviously, if someone is self-harming or suicidal, we want to get them into therapy, get them support. But things like PTSD can interfere as well, especially if it's something related to your body. This is a question I get a lot and sometimes very angrily from patients. Why do I have to go through therapy? And one guy blatantly accused me of trying to get more money. Like, you're just doing this to get more money. And I told him, sir, I am an extern, I'm a grad student. I get paid the same very low amount, whether you are here or not. And that kind of like shut him up. So basically, the biggest thing was to ensure they would succeed post-surgery. Can they make those necessary lifestyle changes? Can they understand the doctor's orders? So our philosophy, those of us who did these evals, was why go through all this time, all this money, all these appointments, because they'd have to be doing check boxes with like nutritionists and their primary care and the surgeon and this and that, right? Why undergo a major surgery only to undo everything the surgery did because you couldn't make the lifestyle changes or stick with them? So everything we did as psychologists was in their best interests. These are arguments we would hear against therapy. I won't be hungry after surgery, so it won't be a problem. you're still gonna feel the hunger in your brain, right? You're still gonna have that motivation. Will what's causing you to eat now still be a problem after surgery? If so, we should probably address that. I can make these lifestyle changes when the time is right. I just haven't yet because, so sometimes we would just do essentially like supportive, motivational interviewing, helping people to make the behavioral changes so they could succeed. And there's a reason that like the surgeon, the nutritionist would actually make people practice eating the way they were going to have to eat post-surgery, and we could help with that. And I mentioned, you're doing this in order to get money. Nope, did not get any additional money. So problems post-surgery are not uncommon, where people will sort of plateau due to grazing or emotional eating or even regain weight. Some people have a really hard time coping with these lifestyle changes. They're drastic. Difficulty dealing with their changing appearance and what that sort of means for their identity. That switching or transferring addiction. And then sometimes just other stuff comes up, right? So we always made sure that they knew we were available to them if anything came up, regardless of whether it was actually related to the surgery or not. Alrighty, so now we're going to touch a little more on what your book talks about in terms of mind and body connection. So health psychology itself is a subfield of psych where you're establishing health and trying to prevent illness. We'll also sometimes focus on behavioral medicine. What are the behavioral issues that are going to interact with your biomedical factors? Health promotion could be a big part of this. So prevention, helping people improve their lifestyles to be realistic and healthy. And then public health, where psychologists or other folks in related subdisciplines might advocate more with policymakers in terms of, on a government scale, what changes should we be doing, right? And so that's just why, for example, when the COVID vaccine became available, not only was it made freely available to the public, but then eventually places mandated that you have it to come back. So this follows the biopsychosocial model. And this is like an intersectional model that acknowledges that our biological, psychological, and social factors all are going to contribute to our health, right? So you could be the most motivated person on earth, psychologically, you could have the best social support, but if your genes are just gonna always keep your weight a certain height, you're not gonna be perfectly a normal weight or whatever that means, right? So like learning that, acknowledging that, figuring out what works for your body and your situation. So we know that the mind and the brain impact the body. They're going to impact our choices that we make in terms of lifestyle changes or health behaviors. They're going to influence our attitudes towards things. We know that the body itself impacts our mind, right? So if we are physically stressed out, that's going to affect our health. If we are injured or ill, that might affect our ability to think clearly. There are many other things that impact our mind, our body. What's going on around us in terms of stress or environmental safety, right? And other things like, again, social support, huge. So there's a couple different theoretical models of behavioral change here in terms of like how do we get people to change their behaviors, change their lifestyle, to work for them and be more physically and mentally healthy. So the theory of reasoned action says effective change requires specific intentions about behavior. So you have to like consciously say, I want to do this to change my behavior. And here's why I want to do it. You have to have a positive attitude about your new behavior. You can't be like, "Oh, I gotta exercise, this sucks," right? You gotta find something you like and enjoy doing. And then also your perceptions of social group support. Maybe you have friends that will take your walk with you or take an exercise class with you, or just generally support you. The theory of planned behavior says that effective change also requires perceptions of control over the outcome. You have to feel like what you're going to do is going to affect it, it's going to make a change. Otherwise, you won't bother. And the big criticism of these theories is that sometimes our health decisions are not rational, right? Sometimes they have to do with emotion or just our situations. And that's important to keep in mind as well, which is again why that biopsychosocial model becomes so important. So how can we make lifestyle changes if we need to? Well, there's this model called the stages of change model that's not only for health behaviors, but really applies here. So maybe you're trying to quit smoking or vaping. Maybe you're trying to eat more vegetables, right? Maybe you're trying to exercise more frequently. Whatever that change is, there are these stages you go through. The first is pre-contemplation, where you're just not even ready to think about changing. If someone suggests that you change, you're going to reject that. That's not possible, or I don't need to do that. Then there's contemplation, where you might acknowledge this is a problem, start thinking about, oh, maybe I do need to change this, right? And then there's preparation and determination, where you start to plan, how am I going to change this behavior? What are the options? So let's say again, as this picture is demonstrating, you want to quit smoking. Are you going to use the nicotine patch? Are you going to use nicotine gum? Are you going to take a prescription medication that helps you to quit? What are you going to do to help yourself to do that? And then you have action and willpower. You have to commit to your plan and enact it. Just do it, basically, right? Then you have maintenance. Okay, you've quit, now what? Right? You've quit smoking, you've started exercising, you ate some vegetables this week. How are you going to keep doing that? How are you going to have long-term success to make this just part of your lifestyle and not a change? And how do you avoid a lapse or relapse? What are you going to do when you're stressed instead of picking up a cigarette, overeating, whatever the case may be? So what are some resources that we have for effective life change? Well, one is personal motivation. We could think back to our motivation chapters, right? Self-determination theory, intrinsic motivation coming from within ourselves versus extrinsic coming from outside of ourselves. Also intentions for implementation of our plan. Thinking about why are we doing the things we shouldn't do? And why should we change it? Again, as I've mentioned, social relationships are going to just keep coming up because social support is like one of the top factors in succeeding with any type of change, be it mental, physical, what have you. Sometimes you need tangible assistance, someone to drive you to the gym, right? Someone to help you cook healthier meals. Maybe someone to physically grab a cigarette out of your hand, right? When they see you about to light up. You also need your folks to have information. Maybe they can provide it to you, or maybe you provide it to them and they kind of reinforce it for you. And just that emotional support of like, I fully acknowledge this sucks and it's really hard to change these behaviors, but I'm here, I'm going to support you. For some people, that social support and also just like inspiration, motivation comes from their religious faith, regardless of their religion in particular. So faith is linked to longer, healthier lives, and primarily in religious nations. So these folks, again, I think a lot of this has to do with social support, right? If you're attending a church, a lot of times, let's say you have a surgery, people will like make a meal train for you, things like that. And you also just have support built in. Okay, so what about stress? We all have it, right? We all get it a little more often in certain scenarios. And what is stress in our brains? Well, it's the activation of this axis, of the HPA axis, which stands for hypothalamic pituitary adrenal axis. And so this is all stuff in your midbrain, which handles your limbic system, related to stress, related to memory. And basically, this controls reactions to stressful events. It's also activated when you experience stressful events. And people with certain disorders, particularly anxiety disorders, the HPA axis is like overactive, which explains why they react the way they do. There's also this subfield or subfocus called psychoneuroimmunology. And this explores connections among psychological factors going on in our lives, our actual physical nervous system, our brain, our spinal cord, those peripheral nerves, and then our immune system. So our T cells, fighting off anything that does come into our bodies. We know that stress can profoundly affect the immune system. And this can be both acute stressors, so something big happens, like when I had my car accident, like my body was keyed up for the rest of that day, right? But also chronic stressors, in particular, folks who live in poverty or who experience discrimination on a daily basis. Those are linked to stress, and those are linked to poorer health outcomes. And so a lot of what, unfortunately, people sort of blamed on being poor or being maybe a person of color is due to the discrimination and the other challenges you face if you're in those scenarios. One of the most obvious ways that stress impacts things is cardiovascular disease, heart disease. We know that chronic emotional stress is linked to higher incidences of things like heart attacks, and that major life changes or life stressors, losing your job, having to find a new job, deaths in the family, things along those lines, those increase your risk even more. Really interestingly, cancer isn't going to be caused by stress, right? But stress can make cancer worse. So stress inhibits our cellular immune responses that would respond to cancers and, keep them at bay for longer. So how do you cope with stress? Well, there's a bunch of different ways. Cognitive appraisal is like looking at the stress and saying, what's actually stressing me out? Do I need to be stressing about this? Is worrying about this, stressing about this actually being effective? Is it going to change anything in any way? Think about coping. Am I going to be emotion focused in coping and just let myself feel my emotions? Or am I going to be problem focused, right? And think about a solution. And which of these is more effective is going to depend on the situation. Right? If it's something you can change, then being problem focused will be great. But if there's absolutely nothing you can do about it, letting yourself feel your emotions and experience that and finding ways to cope with that is going to be your most effective strategy. Being an optimist is associated with better coping with stress, but also better health outcomes. And then hardiness, which was a psychological construct explored by a psychologist whose last name was Maddie. But the idea is that you have like a sense of commitment to your health, to your life, to your goals, and of control over your own life. And so then you'll perceive problems as challenges, or one of my favorite phrases for this is growth edges, rather than threats or barriers. There are also programs particularly made up or constructed for stress management. So these might be groups that focus on meditation, or just stress relief in general. So what are some coping skills that we can use? Well, there's a whole bunch of different ones. In terms of relaxation, you can do what's called diaphragmatic breathing. And that's just breathing deeply from your diaphragm, which is the muscle kind of right under your rib cage that controls deep breathing. If anyone's ever done yoga, it's essentially yogic breathing. And then there's something called progressive muscle relaxation. And I have a video that demonstrates this. So if you want to try it for yourself, you can, or you can just watch for now and go back to it later.
Progressive muscle relaxation. Stress, whether you realize it or not, creates tension in the body. Patients with rheumatic diseases tend to have a lot of muscle tension, especially when trying to cope with the daily joint stiffness and pain. This next exercise, known as progressive muscle relaxation, involves purposely tensing and relaxing different muscles so you can more easily identify the difference between feeling tense and feeling relaxed. Just like the first exercise, the end goal here is to feel less stressed. Also, it's important to note that you should not engage in any of these exercises if you have pain in different parts of the body or distress or limitations. You should not be in any discomfort while doing these exercises, so please feel free to modify or eliminate any of the strategies as you see fit. Let's practice. Again, find a comfortable place to either sit or lie down. You can begin by taking a few deep, relaxing breaths. Let's begin by bringing attention to your feet. Curl your toes in tightly to feel the tensing muscles of the foot, of both feet. Hold this for a few moments before releasing the tension and relaxing the feet. Do you notice the difference? Noticing the difference between a tense and relaxed muscle is the purpose of this exercise. Now we're going to repeat this relaxation exercise with different parts of the body. Now, point your feet down, pointing the toes down toward the floor, feeling the tension in your calf muscles. Hold that for a few moments and release. Once again, noticing that change from moments of tension and moments of relaxation. Now, bringing attention to the thigh muscles, point the toes upward toward the ceiling, feeling the tension in the large muscles of the thighs. Hold that for a few moments, and when you're ready, begin to release. Now bring attention to the buttocks, tightening the muscles of the buttocks as you sit or lie on the floor. Once again, holding this for a few moments and gently relaxing. Bringing attention to the belly, to the muscles of the abdomen, and tensing these muscles as if you're bringing your belly button in, pushing your belly button in toward the spine, and holding here for a moment and gently relaxing. Noticing the back, and here just gently arching the lower back and seeing if you can feel the tension along the muscles in the back as you arch the back. Hold for a moment or two and then slowly release. Working our way up to the shoulders, a place where we tend to hold a lot of tension. Bringing your shoulders up towards your ears, squeezing them up, holding them for a moment, and slowly and gently releasing the shoulders. Now focusing on the hands, making the hands into a fist and squeezing tightly. Hold it another moment and slowly release. Now working up to the arms, you can just gently keep the fists if you like and bring the lower arms toward the upper arms. Pulling the forearms up towards the upper arms, tightening the biceps, and slowly releasing. And finally, bringing attention to the face and the mouth. Here, we're going to squeeze our eyes tight, holding them shut tight, pursing the lips. Holding for a moment and slowly relaxing. Once you've tensed and relaxed all of these muscles, notice how your body feels.
So that's one example of a great coping mechanism. We teach people to do that in therapy. I don't know if people noticed at the beginning, but her credentials, she works at Johns Hopkins, which is a medical school. So a lot of hospitals, medical schools are really recognizing the importance of psychological aspects and incorporating that. Another thing that's become very popular within psychology and just for everybody is mindfulness meditation. And so I have a brief version.
It took me 26 years to figure out that I have
Sweet.
secretly wavy hair. Like, where were you hiding? I started using custom hair care from Pros.
There we go. And again, 5 minutes here.
To begin this mindfulness meditation, just let yourself get into a comfortable position, whatever that looks like for you. When your body feels ready, you may gently close your eyes. With your eyes closed, take a moment to tune inwards. First, simply noticing your body, tuning into the weight of gravity, the points of contact between you and the surface on which you are resting. What else do you notice? What is it like for you to be in your body right now? As you observe this, you simply accept and allow whatever it is you notice, harboring no judgment, just being mindful, noticing what is with a sense of compassion in your heart and letting it be. Continue to do this now with your breath as well as your body. If you haven't already, begin to tune into the sensations of breathing. What do you notice? Just observe, accept, and allow. No judgment. Just letting everything be how it is. As you stay mindful of your breath and your body, with a sense of compassion in your heart. Keeping your eyes closed, you allow your awareness to expand to include the space around your body. It's as if you can sense the air around you, the objects around you, and you just allow them to be as you simply are. There's nothing to do, there's nothing to judge. If your mind wanders, that's okay. Don't judge it. Just return your focus to what is. being connected to your breath, your body, and your sense of presence in the world around you. You let everything simply be, including yourself. You now begin to let your attention travel back, becoming more and more aware of physical sensations by rolling your shoulders, wiggling your fingers and toes, still being mindful of what is, and taking this present moment awareness with you as you
So that's an example of mindfulness meditation where you really focus in on the moment, on what you're experiencing. And as you heard from that, you do try to do it in a very non-judgmental way. The last thing we're gonna look at here real quick is distress tolerance. There's not a video for this. Well, there are a couple of videos, but what you can do is just look at these on your own. So these are like when you're really overwhelmed, what are ways that you can engage in behaviors that help you? So doing activities, making comparisons, healthy comparisons of yourself to other people, using your five senses to self-soothe, and thinking about ways that you can improve yourself in the moment. And so looking at that, making pros and cons lists, using your senses to self-soothe. And all of these come from a type of therapy called dialectical behavioral therapy. And they're really helpful. So I encourage you to look these over, especially if you're feeling stressed with the end of the semester, right? And think about ways that this might work for you, which of these might be really helpful. This video as well about 25 coping skills is really great. And this, I think she's an influencer, she's a therapist. But Katie Morton, she has a series of really great videos, not only with like helpful coping skills, but also talking about what therapy is and what it's not, and what are the different types of therapy. So highly recommend her as a watch just in general. Okie dokie. So on Friday, we're gonna start talking about
This video has been-
COVID, and how that has affected things physically. And we also have a couple activities that we're gonna do. So take care of yourselves between now and then, and I'll see you on Friday.